Hi, it's Patrick Hutzel from Intensive Care at Home, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies and otherwise medically complex intensive care patients by improving their quality of life, and where we also provide tailor-made solutions to hospitals and intensive care units to save money and resources whilst providing quality care. In last week's blog, I talked about the education days at intensive care at home for our nursing staff to keep delivering a high quality service. You can check out last week's blog by clicking on the link below this video. In this week's blog, I want to shine the light once more on the benefits that a specialized service like intensive care at home brings to the community and brings win-win situations to all of our stakeholders. So today's blog post is about how intensive care nurses and pediatric intensive care nurses in the community help the health system cutting the cost of intensive care by over 50%. So most of our clients at intensive care at home would be quote unquote living in intensive care units or pediatric intensive care units and occupy a bed there if we weren't bringing the skills and the expertise into our clients' home. We provide this highly specialized service by sending highly skilled and highly qualified ICU and pediatric ICU nurses into the home up to 24/7, 7 days a week and 365 days per year, whenever needed, to maintain our clients and their families' quality of life at home instead of in intensive care or pediatric intensive care. In essence, intensive care at home provides a hospital intensive care substitution service for mainly long-term ventilated adults and children with tracheostomies, but also for otherwise medically complex long-term intensive care patients. Other clients we provide this intensive care substitution at home to are clients with a tracheostomy that are sometimes not ventilated. Also, sometimes our clients are non-invasively ventilated adults and children with BiPAP or CPAP. We also provide home TPN services for intravenous nutrition as well. And also we provide palliative care services for ventilated or non-ventilated patients at home instead of intensive care. We have also successfully weaned clients off their tracheostomies at home, and we have some case studies to prove our level of expertise when you go into our case studies section on our website. We also offer intensive care patients approaching the end of life to have what is referred to as a quote-unquote one-way extubation at home instead of intensive care. If you think about it, over 75% of the population in first world countries want to die at home instead of in an institution, and yet less than 15% actually do die at home. So why not give people what they want? We have also provided palliative care or end-of-life care to many other adults and children instead of intensive care, and you can get the evidence for that again with all of our case studies. Besides improving the quality of life or quality of end of life by providing our highly specialized intensive care substitution service at home, it has a massive side effect for health funding agencies. The side effect is that it cuts the cost of the most expensive and the most sought after bed in a hospital, which is the intensive care bed, by 50%. The quality of life aspect at home for long-term intensive care patients and their families is arguably such a compelling proposition, and by having the added on economic effect of cutting the cost of an intensive care bed by 50%, it's making it a quote-unquote no-brainer. Furthermore, by freeing up intensive care beds by sending long-term intensive care patients or pediatric intensive care patients home with a specialist service like intensive care at home helps more critically ill patients to access much needed critical care and intensive care beds. It's a win-win situation for all stakeholders by sending intensive care and pediatric intensive care nursing skills into a client's home, rather than having a client spend long periods of time in ICU or pediatric ICU unnecessarily. When patients are in ICU or pediatric ICU long term and therefore have no quality of life, their families have no quality of life as well. That means families put their lives on hold to be with their loved ones in intensive care, and it impacts negatively on the whole family. On the other hand, intensive care at home impacts positively on the whole family because we're bringing intensive care into our client's home instead. Again, everybody is winning with our service. The client, their family, the intensive care unit or the pediatric intensive care unit, the hospitals and the funding bodies, because we cut the cost of an intensive care bed by 50%. Our families love having intensive care nurses come to their home instead of putting their lives on hold in intensive care in a hospital far away from their home. So if you have a loved one in intensive care on a ventilator with a tracheostomy or with any other medical complexities, please contact us on one of the numbers on the top of the website or email me at patrick@intensivecareathome.com. That's Patrick, P-A-T-R-I-K @intensivecareathome.com, and I can show you how we can help you and your loved ones in ICU, or also to get out of LTAC if you are in the United States. Also, have a look at our career section if you are an intensive care or a pediatric intensive care nurse. We are currently hiring intensive care nurses and pediatric intensive care nurses for clients in the Melbourne metropolitan area, in the northern suburbs, Mornington Peninsula, and in South Gippsland, Victoria. We are an NDIS, TAC, and DVA approved community service provider in Australia. Also, have a look at our range of full service provisions on our service section. We have also been part of the Royal Melbourne Health Accelerator program for innovative healthcare companies previously. Thank you for tuning into this week's blog. This is Patrick Hutzel from Intensive Care at Home, and I'll see you again next week in another update.